Hi, I'm Dr. David Schroder with the San Antonio Orthopaedic Group. As a total joint subspecialist, I'm often asked by patients when they get a total hip or they eventually need a total hip, what kind of approach do you do, doctor? How do you get down to my hip joint? Do you go in through the front? Do you go in from the side? Do you approach it from the back? And having trained in total joints as a subspecialty, I have experience in each of those exposures and wanted to take a few moments to talk about pros and cons. From the back or a posterior hip approach, often people worry about dislocation. But the truth of the matter is, most of us that do this approach repair everything that we take down at the end of the case. Dislocation risk is approximately 1.4, 1.2% with modern bearing surfaces with this approach. Patients that come in with an approach from the side, they think that they're avoiding dislocation, but dislocation is a risk no matter which approach that you do. The risks of the side approach or a Harding approach or a modified Harding approach is sometimes you're concerned about patient limping because you involve the muscles that affect your balance as you walk. But it's an excellent approach that has an excellent track record in and of itself. The latest and greatest in the press is a direct anterior approach, and a lot of patients ask about this. A direct anterior approach has its proponents of having a faster recovery time. Patients are happier with it. Pain scores tend to be lower. These are what patients talk to me about when they ask about this approach, and I offer that as well, as do some of my partners. A direct anterior approach, like everything, there's no free lunch. There's still a risk of dislocation. The components still have to be put in the right position. We have a little more bleeding sometimes because the blood vessels that are located in this area. But by and large, each of the hip approaches for a total hip replacement or total hip arthroplasty have their benefits and have their detractors. And as long as we look at your anatomy and match the proper approach to you and talk about the differences when you come in, I think you'll be satisfied with that, and we're going to give you the best surgical approach for you. And that's what I believe in, customizing your care and getting you safely back to walking pain-free again. Thank you.